One.
Hello, I'm Robert Miros, the founder of Hadley Health Technologies, and I'm pleased to provide this video for our application to the American Academy of Pediatrics section on Advances in Therapeutics and Technology Pediatric Device Prize Competition. The device we are submitting for the prize awards is called BiliDx, and it is a point-of-care bilirubinometer. The device I am holding here in my hand allows for the measurement of total serum bilirubin using only a drop of whole blood from a heel stick. This tool will make the assessment of neonatal jaundice much simpler, faster, and more cost-effective for pediatric care providers in the United States when it becomes available in 2026. In order to explain the function of the device, I'm going to pantomime the usage of the product for this video using a baby doll and some fake blood. The way the device works is the provider performs a heel stick on the baby and then takes up 75 microliters of blood in a micropipette. This blood is then dispensed onto a disposable cassette containing a lateral flow strip. The drop of blood is then separated by the lateral flow strip, with the plasma advancing down the length of the test strip. This serum for the whole blood will have a tint of yellow if the levels of bilirubin are elevated. After waiting 10 minutes, the test cartridge is placed into the BiliDx reader. The user then simply presses one button and the device will provide a readout of the total serum bilirubin level. This measurement can then be used immediately to determine if the baby should have phototherapy administered or might require more intensive care. The system will radically change the nature of bilirubin diagnostics, as the current system requires that the provider either do a transcutaneous reading, which are known to be inaccurate, especially on melanated skin, or refer the patient to a separate test laboratory. This referral can result in a loss to follow-up on the part of the patient's family and will also incur additional costs within the patient's care. By putting a point-of-care TSB diagnostic device into the hands of the provider that yields a result in 10 minutes or less, we are dramatically improving patient care for newborn babies. We are applying for this prize in order to support our ongoing work in submitting to the US FDA for 510(k) regulatory clearance. The product is currently CE marked under the European medical regulations. At the time of development, approximately 3 years ago, the market focus was for low and middle income countries. Now that the product has been in wide use globally, we are excited to bring it to the USA and have an impact here in our own backyard. To get the product cleared by the FDA, we also intend to have it cleared for CLIA usage. This will allow its use in the clinician's offices as opposed to requiring a trained pathologist or laboratory technician. The AAP SOATT prize will make a big difference in funding the required clinical evaluation to support the CLIA waiver application and the ultimate 510(k) application. We hope the prize committee finds this innovation as exciting and impactful as we do, and we look forward to hearing from you very soon.